Good morning. Good morning. All right. I'd also like to extend a warm welcome to all of you for the 2019 Breakfast of Legends. Every time I think of the title, Breakfast of Legends, I have to think of Angela Diaz, who is a true legend. Why don't we acknowledge that? I would also like to acknowledge the co-chairs of this event for their wonderful efforts to ensure that today is a great success. If they could please stand when I acknowledge them. Dr. Melissa Alvarez Downing, Daniel Atlas, Beverly Boudon, Dr. Keith Benkoff, Dr. Daniel Cameron, Dr. Sharon Edwards, Tony Fiore, Barbara Green, Susie Greenwood, Heidi Leeds, Dr. Faith Miller-Sethi, Marilyn Rose, and Dr. Richard Saffer. Thank you very much for your efforts. Now, I also want to welcome our distinguished honorees. They don't have to stand because you're going to see them in a few minutes. Jerry Bruno, Strategic Project Manager, City of New York, Department of Homeless Services, very important. Rachel L. Colin, Primary Care Social Work Coordinator, Mount Sinai Adolescent Health Center. Raja Flores, Stephen and Ann Ames, Professor and Chairman of the Department of Thoracic Surgery at Mount Sinai. Yasmin Mock, Head of Client Relations and Chief Operating Officer, Kimmelman and Baird. Lisa Satlin, Herbert L. Lehman Professor and System Chair of the Jack and Lucy Clark Department of Pediatrics at the Icahn School of Medicine at Mount Sinai. And Patrick Wang, President and Chief Executive Officer of Health First. Congratulations to all our honorees. So today we celebrate, and time flies, 51 years of the Adolescent Health Center at Mount Sinai, which has always been characterized by innovation and excellence. Innovation is the single most important element in healthcare today. And because of the challenges facing teens are constantly evolving, always new challenges and ever-changing, we must be innovation in how we provide services to our adolescents. It is very clear that the Mount Sinai Adolescent Health Center is a beacon of innovation in addressing the emerging issues facing teen health in our nation. Over the decades, we have seen several crises in our adolescents in terms of well-being, joblessness, delinquency, heroin. We know the opiate crisis and how serious it is, and other substance abuse, teen pregnancy, tobacco use, HIV, gang involvement, violence, and exposure to trauma. The list goes on and on. You can see what the challenges are that we face. And today we have emerging concerns, such as more violence and its impact that damages our social environment. And it also includes sexual exploitation, trafficking, and as I have mentioned, all forms of substance abuse. The Mount Sinai Adolescent Health Center always strives to be essentially ahead of the curve, to be able to address the next crises as they occur. They need to be nimble, flexible, and always ready to innovate. My career has spent a lot of time understanding the impact of trauma and how to build resilience among our children and youth. So one example that is very important to me personally is the Mount Sinai Adolescent Health Center's work in identifying and helping trauma victims who would otherwise go untreated. Trauma is rampant in our society, and it is particularly devastating to our youth. whether it is in the form of family violence, sexual abuse and assault, community violence, gang violence, school shootings, and so on. No one is immune. But as so much talk relates to increasing mental health services, which of course should be done, it is important to understand that many, many traumatized youth will never show up in traditional mental health service environments. Many youth victims do not identify themselves as needing mental health care and do not know enough to get the help that they desperately need. This is especially true among our inner city youth who live in environments where unsafety is so common. It's a part of life. That they superficially seem resilient to it, but that's not true. So frequently their experiences is manifested in unrecognized hopelessness and depression and unplanned pregnancy, substance abuse, and so on, which may mask the impact of the underlying trauma. So over so many years, the Mount Sinai Adolescent Health Center has developed a highly integrated model of care in which young people get all they need under one roof, from mental health to dental health. This is the center's biggest and most important unique innovation. You can get everything under one roof. It's integrated. Its physicians and its psychologists and social workers, and indeed all of its staff, are trained, committed, and sensitive to the world in which our adolescent traumatized victims live. Because of this, when teens come through the door of the Mount Sinai Adolescent Health Center, whether it is for a physical exam, a pregnancy test, for STI treatment, or a sick visit, their trauma history is uncovered and immediately addressed. It has been at the forefront of recognizing trauma in adolescence and helping youth who would ordinarily not undergo services. So what has happened? The Mount Sinai Adolescent Health Center, more than any other adolescent health center in the United States, has helped thousands of young trauma victims, thousands, many thousands, who would otherwise forgo care. While the center has been acknowledged for this unique approach over its many years, the integrated care model is only now being recognized across the country as the gold model of care for all groups. And the Mount Sinai Adolescent Health Center has been the leader in our nation in providing that care, and now is being modeled all over the country. But we recognize, while the Mount Sinai Adolescent Health Center has been doing this for years, it needs to continue to do it, and it needs our help to be at the forefront. At the center, other innovations are ongoing, including its groundbreaking work with HIV-affected youth, with teen parents, with transgender adolescents. Just this last month, the center opened an adolescent prenatal service that is now integrated into its general services. While the center works to prevent pregnancy, some pregnant teens will decide to become parents. Overwhelmed by the job of parenting, these teens often forgo their own care while keeping their appointments for their babies. In the center's parenting program, the whole family is seen during the same appointment, integrated care. So they receive the care that they need as a family. This three-generational approach is also highly innovative. By developing prenatal services at the center, pregnant teens who might get lost to follow-up now get the care they need as a family. So thank you all for being here today, very much, by supporting what is a jewel at Mount Sinai, a leader in the nation, and will be innovative as we all go forward together. So thank you very much.